Hi everyone in Schema Therapy Made Simple. I'm very excited to be here today with Zhi Liu. They are with us today to talk about gender diverse clients and the schema therapy model. This is Zhi's area of expertise. And I feel really privileged to have someone here to talk about such an interesting issue that not many of us have an opportunity to have direct expertise with. So welcome, Zhi.
Thank you so much. Thanks, Nadine. Happy to be here.
So Zhi is originally trained by Jeffrey Young and Wendy Bahari in New York. She's now an ISST trainer and supervisor with the Schema Therapy Training Australia group. She's got a great training on working with online schema therapy. It's another one of her interest areas. And then on top of that, she's really passionate about working with LGBTQ plus clients, gender diverse clients, culturally and linguistically diverse clients in the areas of complex trauma, grief, and personality disorders. She's also the Facebook host of the Psychologists and All That group. So we have something in common there, being Facebook hosts, which can be a bigger job than it seems at times. And she is very much involved with a group of Sydney practitioners who are dedicated to working with gender diverse folks. And that group is called Gender Galaxy. So Zhi comes to us today with just a wealth of experience and passionate interest in this area of working with gender diverse clients. Would you like to say anything more about the things that you do, Zhi, at this point?
So about me, so I also work, for the longest time, I was the only Chinese speaking schema therapy supervisor. And so that's been interesting. I do a lot of supervision for clients, for supervisees in Hong Kong and China. So kind of growing them. And now I have supervisees who's now becoming a supervisor who's Chinese speaking. So yes, I'm really excited about that too. And yeah, I've done a lot of stuff around developing schema therapy for the online community. So that's kind of like my other hat. You will have seen me wearing.
I think that's really great. I think to have someone who can speak a different language fluently, and then that broadens the application of schema therapy and delivers it to countries where it may not be able to flourish, because it is very driven by the English language. So that's fantastic. And I imagine you're high in demand for rating tapes as well, because many people who could do that. And then with that, because once we bring the language into schema therapy, you can really start to look at cultural adaptations of the model. So it's so important that we have people like you who can create that bridge for the model.
And how shame works across different cultures and how we address the critics in different ways and all that. Yeah, it's different.
Yeah, I'm sure that could be a whole interview for another day, actually. So I'll have to keep that on the back burner. So what led you to become a schema therapist?
Yeah, so I like that question. And you also, when you send that question, as we were talking before, I wanted to get the interview questions because we all like to be a little bit overcompensating and controlling in our preparation. So a bit about how I got into this. So, I'm non-binary myself, and I use they, she pronouns. And I'll just explain that a little bit. It's kind of good, actually perfect introduction on this topic. So when you are first working with a gender diverse clients, one of the most important things is to ask them what their preferred pronouns are, or what their pronouns are. And this really shows that there's a interest in, wanting to refer to them correctly, and that's very affirming. And I use they and she in this order because I, feel most consistent with they, them. However, over time, I realized that it was just such a fight. And because of people who don't know me, people who see me on the street, they would naturally use she, her pronouns. So I started to use they, she because it made it more comfortable and less kind of jarring for me each time that I could still, the she is for people who don't know me very well, or clients, or people that I kind of don't kind of put myself forward so much. Whereas the they them pronoun is one that I want my closest people in my life to utilize, because that's most affirming of who I am. So when you see clients and they use kind of some you might see some people saying, he, he, they, and that means that they, that order is an interesting one. So it's always a good conversation to have, and it sparks off like understanding why the person has it in this way, and kind of gives them a sense of what their schemas are as well, probably. So got into schema therapy when I first went to the World Congress on CBT in Boston many years ago, and saw Jeffrey Young speak as a keynote, and he was speaking in a room of thousands, spoke about a male client, and there was just such emotion and empathy in the way he discussed this client, and I was moved to tears in this room of thousands. It was so so touching, and this really kind of very humane and empathic therapy just felt like second nature to me. Because I am a very empathetic person. I love connecting with people, and I remember, when I first started uni, I was saying to a uni mentor, like, oh, not sure if I could do the CBT thing, because I feel so much, and is there something wrong with me? Why do I have so many emotions in the room? And he said, no, this is your superpower. Work through your stuff, but this is actually a very helpful part of therapy. So when I found schema therapy, it felt like a very natural, like a sense of coming home. And so in 2014, I moved to New York with my partner, and initially got in touch with Scott Kellogg through wanting to find a place to volunteer and learn. And I connected with a group called Streetworks, which was a harm reduction based homeless and drop-in center for youth, for homeless youth. And I just met so many wonderful young people who many of them identified as trans or non-binary. And I just learned and saw the spectrum of gender identity in front of me play out. And all of this was done without pathologizing. Right. And I watched their gender expression being separate to their gender identity. I saw their identity evolve over time. And back then we would start each meeting asking for the person to introduce themselves and ask them for their preferred gender pronoun at that point, or PGP. And interesting enough, that's kind of an out-of-date term. So when people worry about terminology, I say, don't worry so much about terminology. Language evolves over time, because that's just how language works.
Right.
And so now what people use is not preferred gender pronoun, but actually just gender pronoun, because the language implies that it's not what you prefer, it's actually who you are.
Right? What it is.
Yeah, exactly. So from there, I saw, that despite this kind of wonderful, colorful celebration of their gender, they were homeless largely, most of them due to lack of family support that was often a direct result of their gender identity. And the consequential mental health issues, the trauma that caused by the family rejection and violence, and then all the things that happened because they were homeless, the violence that they were confronted with as well. So that was kind of a baptism of fire, and most wonderful, colorful, delightful way. And then in New York, I started my own practice there called Life Therapy, where I worked with a lot of creative folks who didn't have health insurance. And again, there was so much discussion about gender identity in a fluid way. And I was kind of fumbling around in the area, wasn't trained, but because of my own view around gender identity, it was very fluid. So I could create this sort of space to explore it without sense of danger, or without it meaning something so concrete, and brought in a lot of playfulness and encouraged connection with community, expressiveness, whilst holding the pain that is on the other side. So that kind of coming into the gender stuff. And then I found, when I actually did my accreditation with Wendy and Jeff the New York, New Jersey Institute, which is such a delight. And I feel like there's a bit of a genealogy in schema therapy training. I don't know if you notice, like if you feel that way, like depending on where you get your training, there's a bit more like a CBT flavor, a Gestalt flavor, or psychodrama flavor, or the emotional focus flavor.
What's the flavor that you got?
I feel like very kind of psychodrama and Gestalt. That's yeah, kind of from Wendy and Jeff. Yeah, and then back in Australia, started my own private practice here, and started co-facilitating with Rob Brockman and Chris Hayes with the schema therapy training, which is wonderful. And yeah, and then with COVID, started doing lots of online work and training other therapists on how to adapt schema therapy to the online world, which feels like it was so hard. Everyone was so worried about it back then, and now it's all second nature, isn't it?
Yes, and I've actually got Hagara coming on, who did the online training that's on offer with you, and she is wanting to talk about the online relationship as well. So that's an exciting thing. But yeah, I think you're right in that. As would be normal, all trainers are going to bring their personal bent to the training of schema therapy, and schema therapy, since I've delved into it quite fully, it is really evolving, and it has different branches within it, which are going to sit better or less comfortably for you in terms of how you practice. But yeah, it's really interesting, and it's so wonderful, I think, to hear about how your passion for this work started. And I can imagine within that context of New York, there would be just a really breadth of deep, rich experience because of the cultural aspects of that city as well. And, you know, I think that what you mentioned about the trauma that happens when people's families reject them. And I just wondered, in your experience, when families are accepting, is the trajectory quite different in terms of the level of distress and trauma that's experienced?
It is and it's not. Like in terms of how it, like obviously it will have a huge impact, but like it's kind of it's hard to say how directly it'll affect the person's mental health, because you know, one of the things that we starting to identify, and we want to kind of do, like I conceptualize separately, is this idea of a social critic.
Yes.
Right. And this, in addition to, you know, the punitive, demanding, guilt-inducing critic, we want to look at the social critic. And I think this is applicable for not just trans and gender diverse clients, but anyone who experiences minority stress and the messaging around that. And so it's not just the kind of, you know, direct discrimination, it's also kind of how it impacts on people's relationship, you know, perceived and actual felt rejection and all of those things, and how it kind of compounds on existing mental health issues. So yeah, so it's a kind of a complex answer. Like you'd think absolutely it should help, you know, strengthen the healthy adult if the person has a healthy relationship with their family. But because you know, that kind of, that gender identity formation happens at such an early age, you really need a family structure that, like, and carers that are mirroring that gender identity formation from an early age. So, you know, when the client comes out and the family is accepting, that's great. But that's kind of not where it starts, right? It starts very early on as well.
Yeah, and I think different families have got different capacity to even have, you know, I've heard you use the word gender fluidity a bit, and in some families that's not something they're even across, right? And so they might at some stage of their child's development accept this change, but they really, from early on, if they've been unable to see gender as a construct, that will impact the child. But yeah, 100%. And I've loved some of the work that I've seen done in the schema community around minority stress, because I think it is so important and often forgotten in therapy. We get very focused on the individual and we forget about this broader social context. And certainly at the moment, one of the things that concerns me is there's almost too much spotlight on the transgender community in some of the right-wing media.
Yes,
and it's extremely critical and invalidating, and and things like that. So it's almost like what I saw originally as a really positive movement towards people understanding gender fluidity to these sort of conservative, we are not doing that, and push back. So that is going to, be part of that social critic.
Absolutely. And it's directly harmful. It's, it's directly harmful to people's access to life-saving treatments. It creates such a messaging of, someone's value and limits their opportunities and all that. And also, you said, like, the idea of like gender as a construct, like it's so true that, as soon as someone is pregnant, one of the first questions that they ask is, are you going to have a boy or girl? Right? It's so innate that, prior to the child becoming, a person on earth, like, there's this desire to gender them. And why do we do that, right? And I think for most people, it's, you want to place a set of expectations around this being based on what gender they are, right? And so you're kind of stuck in this gender role, even when you're just like, size of a pea. And so that's so fascinating. And beyond that, some people have gender reveal parties. Again, really reinforcing that, you go into a shop, there's blue and pink for baby clothes. And so gender is something that is so inescapable. And for a lot of parents, when they have a kid, they have this sense of, if I have a daughter, I will have this type of relationship with them. If I have a son, I will have this type of relationship with them. And it's so implicit, right? And so when a child comes into the world, before they have language around this, and there's this sense of somehow their experience of their own gender just is a mismatch with mom. Mom gives me dresses, and I don't really want to wear dresses. Mom wants to put things in my hair, and I don't really like that. So how does the child start interpreting that about themselves, and what does that mean for their, schema development, right? It evolves in a very benign way.
Absolutely. And there was something I was going to say about that, but it slipped my mind. But yeah, I think it's sort of like there's no opportunity just to be a person with your own characteristics because of this gendering that happens. And, I sometimes work with people who are quite devastated that they've found out they're having, a boy when they've already got 3 boys and they wanted a girl or that sort of thing. And all of those feelings are real, but at the same time, I've also seen families in which, it's assumed that dad will have a close relationship with the son and they'll go fishing, and then that child has got no interest in those typically masculine hobbies, and one of the daughters might actually be interested in that. So it's all in the construct. It's not actually real. It's not actually about who you are as a person, but there seems to be a need for our society to pigeonhole people and feel certain about some things. And then I guess if you're a young person who's just not feeling that any of that is right for you, it must be creating this internal storm of why can't I do that, or why can't they see that in me? And you can just imagine.
And when you compound this into a peer level, right? Like what is expected, what happens when a kid who's assigned male at birth start playing with the other little girls? What names are they called from very early on? What expectations are placed on them? How do the other kids treat them? All of this stuff, like when we talk about, it's not just family, it's like how does the environment react to who they are? And I think you start to see real differences in, and in recent times in places, in schools, in environments which are very, very diverse and open-minded and hold the space for gender fluidity or any like diversity of identity, or, whether they're neurodiverse or whatever. Then people do perform better, right? When people are supportive of these differences and celebrate these differences, their mental health improves, right?
Yeah. So I guess what we've been talking about is there is a lot that can feed into the amount of distress that someone who's non-binary or transgender might experience. And we don't want to weigh too heavily on the side of family acceptance, because that's just one aspect of.
Yeah, it's very critical, but I think it's kind of working through all of this. So I think in the conception, like, using a schema therapy conceptualization, we can, from like if client is coming in to to address the gender dysphoria particularly, then doing a gender history assessment is really important to kind of ask questions about, when, how old were they when they started to kind of question what their gender identity was, what sort of things they do in their clothing or activities that they engage in. How did they explore this part of themselves? How did people react? What did mom say? What did dad say? What did granddad say? How did the school react? And that, is then a direct link to doing your schema therapy formulation, because, those two are so linked.
Right. Yeah. So one of the questions I did have for you was about what can therapists working with gender diverse and clients do to help with their client's experience, or how do they incorporate more affirmative practices into their work? And you sort of covered it a bit by talking about asking about pronouns and sticking with those pronouns. Is there anything else that you wanted to add to that is helpful for people to know?
Yeah, so I think some of this I feel like it's kind of, to me, is kind of like really very clear, but I want to kind of spell it out as well, that, the goal here, which I've taken from one of the very few articles written about schema therapy and working with gender diversity. It's actually in the ISSC bulletin, and I'll send some of these resources out so you can share them. The goal here is to facilitate healing through countering minority stress experienced by unsupportive cultural, social environment that values either gender binary, which means the person has to be male or female, or that the person has to be the gender assigned at birth based on their anatomy. We say that, genitals don't have a gender. And if you find that controversial, then, that's something, a good place to explore what that means. I think, so the goal of gender affirming schema therapy is the same as any other schema therapy goals, right? It's to help the clients weaken, and break schema-driven maladaptive patterns in order to build that healthy adult so that they can be the full breadth of themselves. But something I think is really important to keep in mind is that, psychology comes from a long history of pathologizing gender diversity, right? And we have to understand and acknowledge that within our profession. And as recently as the DSM-4, the term gender identity disorder was used, right? Now it's gender dysphoria in the DSM-5, but how insulting. Like, I don't have a disorder because of my gender identity, right? And in fact, the ICD-10 uses gender incongruence, which is actually a much better term, because this is really moving away from requiring trans and gender diverse people to be experiencing distress or pain, or be defined by their distress or pain as, to prove themselves as being trans or gender diverse in order to receive treatment, especially when they are going into engaging in hormone therapy and gender affirmation surgery and things like that. So healthcare settings, by definition, is, it's really harmful in pathologizing transhood, right? In being trans and gender diverse. So understanding this means that, we can actually go ahead and actually advocate for our clients when they're navigating medical systems, when they are engaging with someone who is, misgendering them, advocating for them with a family member. So with this sort of work, advocacy is a really big part of the work. And if you use it from the schema therapy model, it's, it's the same thing as we advocate for kids, why their parents have to, can't engage in that sort of harsh disciplining and things like that. Yes. So understanding that this problematic narrative, which has been dehumanizing and infanticizing, is really critical in addressing schema maintenance. And this and our language is so important, right? So, because the idea that gender identity presentation, any other gender identity presentation other than being cisgendered, right, which is the gender that, being the gender that you are assigned at birth, is seen as a psychiatric condition, right? It's a deviation from the normal, right? And so I will, hear colleagues talk about like, oh, like blah blah blah, when a man and woman get married, or like kind of like inferring within the language that there is a normal and this is an abnormal, and and it kind of reveals the person's personal beliefs. And that is really harmful to clients and the way our profession discuss, these issues away from our clients as well.
Yes, and I think there are a lot of people who would not even realize that they're being harmful, right? Because they haven't examined their own beliefs about gender. So it sounds like the first step is to actually get in touch with what you believe about gender and how you might have come to understood those who aren't cisgendered as abnormal when really it's all normal. And I think the DSM is going to get challenged to a big degree on many, many fronts. And I just had a thought when you said abnormal before. When I was in undergraduate, we had abnormal psychology as the units, and we had an abnormal textbook. Yeah. And the more and more I work as a therapist, the more that I realize that everything someone presents with is normal. It's a reaction to something that's happening, and sometimes what's happening to them is just really toxic.
Absolutely.
But their reaction is, and when you start to see the same abnormal reaction happening over and over again in response to certain things, then we have to really question whether what we're calling abnormal is that. It's actually a very typical response. But if you're not saying I'm fine when something traumatic or difficult is happening for you, our culture says, oh, that's abnormal. And so the other thing, it sounds like, getting into your mindset as a therapist that you are helping treat the minority stress, or helping someone come to terms with a lot of their distress is coming from the minority stress and the environmental messages and societal messages that are compounding on their sense of who they are and their worth and those sorts of things. Have I got that right?
Yeah, absolutely. And also believing in clients when they report rejection, even if it's perceived, is really important, because often, like with a lot of clients, like if you kind of apply it across other settings, like often people will hear this like, oh, are you sure they mean it that way? Maybe you're imagining it.
Gaslighting.
Absolutely, right. And because of how much rejection and negativity they've experienced, sometimes they may just perceive it that way. But if the therapist cannot hold that space to believe them and validate, that perception, then that's going to be really traumatizing, right?
And just on that, I think we probably run into a bit of a pickle here as schema therapists if we say to someone, oh, do you think that's just your schema activating?
Yes.
Yes. So that's going to be invalidating. And actually, I just did the EMDR conference, which is the EMDR conference in the US, and I did one on racism and therapy. And there was a lot of talk about the dominant group and how we actually do that all the time. And being a white woman, I'll just say I'm in that group. I try not to do these things, but we minimize people's experience of oppression. So that, oh, do you think that really happened? I'm sure they didn't say that about you because you're Black, or, when really people who are on the receiving end of minority stress, I'm sure they're pretty good at picking up when they're being discriminated against, because it's an everyday experience.
Yeah. And this is the thing about, our identity. Like, if we don't have that identity, we just won't see it. Right? Unless you really consciously make that effort to see it. Like, I am an able-bodied person. I am going to not see things that are, like ableist, right? Unless I work really hard to ensure that, right? And, a friend recently was talking about not having enough Auslan interpreters at this event. I thought, oh my gosh, I didn't even think about that, right? Because it's not a concern to me. No. But this is, and so I think in a way, instead of shaming ourselves for not seeing it, which then is not, as we know, not going to be helpful for our own change process, but understanding that we will have a blind spot based on things that we do not, identities that we do not hold. Yes. And so we have to work harder and also hold space for clients, perceptions of what's happening, because it's so prevalent. Like, it's really amazing how you see, like that, there's a wonderful public identity trans activist, writer, poet called Alok Vaidmanan, who's on Instagram, and they post so many wonderful things and break down like big textbooks, and it just contributes so much. And their experience of daily violence on the street, just the slurs that people yell at them, how the threats of violence and the comments they get on such a regular basis, it's so harmful simply because they are non-binary and present in a way that does not pass in a gender binary. And it just brings up so much anger and disgust and fury in certain people who are uncomfortable with their own, and Alok says, uncomfortable with their own vulnerability and their own gender, just feel that they have a right to be so violent. It's quite phenomenal, and you don't, it's hard to believe it until you are on the receiving end or until you actually look into this.
Yeah, and actually one of the main messages of this Embryo conference presentation was broaching is really important and can be very healing, because people from minority groups will often think there won't be a space in therapy for this, or they won't get it. So if you lead in with it, and I wonder if you find that's the same for gender.
Yes, and that's definitely one of the most important thing that I want to kind of relate this to like when I started training people on online therapy. There was so much anxiety. Most psychologists are Luddites. We don't go into this sort of work and like, oh, I'm going to be great on the internet and I'm going to tackle the Zoom thing, right? And so therapists often kind of get into it and they're like, oh, how does this thing work? Oh, I don't want to make a mistake, right? But as we know from Circle of Security, the adult, the therapist in the room need to come into it with confidence, right? With sturdiness, with this openness, encouragement of exploration, welcoming the person, and delighting in their need for comfort. And that's exactly with this topic as well. So if the therapist is anxious, right? If they're going to go in, oh, what if I make a mistake with this or that, or use the wrong terminology? They're gonna slip up, right? And so I think, as I said earlier, like language evolves. If you make a mistake, correct yourself, think sorry, say the right thing, move on. Don't freak out about it. Otherwise, the client ends up having to, make sure that you're okay, and because they feel like that's their job to do that. And also, it's really important for the therapist to lead and to provide safe space that they're going to be comfortable talking about this. So awkwardness, silences, not asking enough questions, that sends the message to the client that this is something to be ashameful about. If you have forms that that do not give any other options of gender other than male or female, or you don't ask about sexuality. If you confuse sexuality with gender expression, with gender identity, which is such a common one, it's like I've had to inform my GP recently, like around just because you're gay doesn't mean you are, or just because you're trans doesn't mean that you are gay. Like those two things can correlate, but it's not a causation.
But that's again, it's part of the culture, isn't it, to think gender determines who you're going to want to have sex with, and so it's So I just want to say, delighting in your client's comfort as a need that you can offer as a schema therapist, or I think really any other therapist, but let's face it, not all the models address needs to this degree. I think that is a fantastic phrase, and so just really helping to make that space somewhere they can really explore and talk to you. And so, if they are experiencing daily harassment on the street because of their identity, they can come to you and say, this happened, and they will be pretty much 100% sure that you will say, okay, tell me about it. That sounds really tough. Not, are you sure that your schema of defectiveness triggered and you might be kind of having a bigger reaction than you need to this slur?
We know is what schemas are about, but we don't rub that in a client's face, right? Like, it's not how we use schema therapy. If that's how we use it, then speak to your supervisor, right?
Yeah, that's right. So it's about... And I think one helpful thing that was said to me when I was having my own schema therapy was, these things that are happening to you are real, and your schemas might intensify the reaction you're having, but you're probably still going to be like upset about this.
And again, if the person is experiencing constant daily triggers, that's going to intensify the schemas a gazillion times more.
Yeah, absolutely.
And for a lot of trans folks and gender diverse folks, like, it is a daily reminder, because the daily, there's for a lot of people, there's daily reminders of of them being misgendered, or like discomfort with their own body, gender dysphoria with their own body, or an adjustment after gender affirmation surgery. Like there's so much to it that the triggers are not kind of it just stops at some point.
Just on that note, one of the questions that I sort of thought about, but I didn't give you when I was thinking about schema therapies, when we're doing affect, float backs and bridges, we're often going into the body, like what you've got in your body. And I wonder if someone is experiencing actual gender dysphoria of the body, whether that is something they'll find too difficult, or we might avoid doing that. I'm not sure what you thought.
I think it's good to not assume what it's going to be, because it can also be a form of exposure, like a kind of like a slow exposure to comfort with their own body that's not related to gender. Right. So it can kind of it's like often, like I'll get these questions. I'm like, well, it could go any way. I think it's more kind of holding space to check if it brings up discomfort, it brings up dysphoria, and to then kind of create and offer alternatives if that's the case. But in my experience, it doesn't often happen. And if it does, then you can kind of focus on the images, or this, and I don't know if we should jump into that question about when the child, like how to
why not? I think
it's kind of relevant now. So one of the questions that's commonly asked is when you do a float back and you're working with the vulnerable child, and that kind of concern of triggering clients if the vulnerable child is how do we work with that? And again, there's no straight answer, and it actually is not as complex and sort of like there's not sort of that much, often there's not that much fragility to it. And when clients are unable to engage with their vulnerable child, it's not too dissimilar to when there's a lot of shame, when you're working with someone with a lot of complex trauma and there's a lot of shame with the child. And so there's a few options in kind of making the child mode more gender diverse, appropriate, right? So firstly, we want to be very provide a lot of psychoeducation for why we do experiential work, and discuss the concept of the vulnerable child mode sensitively, talk about how the child feels about themselves as a child. But often I found once you actually do the imagery work, sometimes they actually have more comfortable than you think they would be. And another, and you can kind of work with just saying how you just by asking how best should I refer to that part of you, right? And kind of just offering them up, asking what it feels like.
So just because I haven't asked the question now, just for those people who are listening or watching, what can happen is you'll do a float back, and because the child that they see in the picture of themselves is perhaps being either forced into a discongruent gender role that they no longer want to identify with, or is quite distressing for them, that can bring up a lot of stuff. And also because their name is a name which sometimes is called a dead name, so they don't use it anymore. They've got their name which is consistent with their gender identity. And so some schema therapists run into either clients becoming quite distressed or not wanting to do the exercise. So what Z's doing is giving us some tips onto how to help imagery rescripting go better and to be affirming for the client and not overly distressing.
Yeah, absolutely. So some ideas around just like Wednesday, if we were to explore the side of you, how best should we refer to that side of you? I'm aware that when you were younger, people refer to you with a different gender pronoun and name if they have, if they're no longer using that name. How would you like me to refer to that side now? Some kind of useful bypasses can I call it little X, right? So, if the name is Alex, saying like little a. And sometimes clients may choose a name that is not too dissimilar to their dead name. If that's the case, you can find a common thing, common bit, or you can say like, little you, right? It's like most generic, like the little kid, the little you.
Yeah.
Or I've also even worked, with clients, like imagine yourself like whatever form you want. Some clients imagine themselves as an animal, right? One imagine themselves as a unicorn, right? Or kind of just their form. And so there's so much creativity always with schema therapy around this.
Yeah.
And you don't necessarily, they may not necessarily need them to have a very specific gender, just kind of a feeling of themselves, right?
Which in itself is really the goal, isn't it? Is to be you and the you that you've always been. In schema therapy, that's what we talk about anyway. But with this population of people, I think it's particularly important. But I mean, I love the fact that you could go back and be a unicorn. I mean, I think that, and so it sounds like for some schema therapists, and schema therapy is a big model and it's a lot to get your head around. So I think sometimes people start developing these rules to try and cope with that.
Absolutely.
And it sounds like what you're saying, well, there's no rule. You don't actually have to be your little self with all the parts that were extremely distressing. And I sort of think about it in my trauma lens. I'm thinking about this as sort of titrating it to where they can tolerate that. Absolutely. And where the phobic avoidance doesn't kick in to the point that you'll get people refusing to do the exercise. Or no, I'm just thinking perhaps people are really concerned that if they float back into their child self, there's some sort of push to acknowledge that as real or something, because that's been their lived experience. So it'd be about really, as you said in the beginning, really educating the client as to why we're doing that. And there's no agenda here. This is not about gender questioning or any of that sort of stuff.
Absolutely.
It's just about
you're not doing it. And that titration is in complex trauma is so important, right? So there's been times where, like often when we work with detached protectors, we often kind of dial up the intensity of the image, often I dial down the intensity. So I would put, the child on the other end of the street or behind the door. And it's like, you're here. I want you to imagine yourself as you are today. And behind the door on the other side is little you. Can you feel little you leaning right up against the door? Right. And so, we can even, like, at least in the very beginning, as there's a lot of shame around them, their old form, we can kind of work with that. And it's a form of exposure, kind of feel like to reduce that sense of shame as they're experiencing this with you as an observer, with you, the therapist, holding that space. Right. So kind of, any complex trauma work that you can bring in is really important. Right. So
and it sounds like bringing those principles into it and thinking about what you're actually trying to achieve here. And again, I think of that. I love that, what you said about delighting in their comfort. So we're going to do the work, but we're not going to do it in a way that's going to make you explode into a million fragments, or we're going to do it at a level that's safe and comfortable for you. And of course, we've got to have a little edge in there sometimes, but not so much that you're going to leave the session wanting to harm yourself, or whatever the client might be afraid of. It's going to open up.
I might give you an example of a case study of fun imagery, in the way that, when we do limited reparenting work early on without a perpetrator, right? So, this case study, the identified case study, Alex, who's a trans woman, assigned male at birth, works in the arts, came in, was feeling really restricted with their dating, experienced many homophobic and transphobic slurs as a kid. When they came in, they had already, been quite far into their gender affirmation surgery, and is living quite comfortably as a trans woman, but still kind of like wanting to address, they were quite depressed and anxious and not able to kind of build connections with colleagues and friends. We very quickly identify the schemas of defectiveness, social alienation, emotional deprivation, impulsivity, mistrust and abuse. Nothing surprising, but kind of given their family, given their history, those are very clear. we were, we had, we identified this critic, there's a number of critics around, punitive critic around from the internalized stigma, rejection, abuse, seen as a freak. There were implicit critical messages of the disappointed look on dad's face when Alex performed badly at sports, and as a kid, and dad wanting Alex to be part of the sports team that dad was coaching, and to explicit messages of being called sissy at school, because Alex was friends with lots of girls, wanting to have long hair. And there was also lots of internalized transphobia, which defectiveness, shame was really at the core of it, and social alienation. And the social critic there was, so much of the messages they were receiving us. But also, we looked at in media, depictions of trans people have been so horrific for such a long time, right? There's a wonderful documentary on Netflix called Disclosure that goes through the history of this, which I advise everyone to watch. And so, we looked at how, this is when we look at kind of what does being transgender mean to Alex, and kind of just did a brainstorm, there were all these horrific messages which were part of that, that social critic, that she was carrying with her every day. And so, she would often engage in compliant surrender mode to get this sort of social, desired acceptance. The child mode is very clear, but also this attached self-soother, used to engage in self-harm prior to therapy, but was occasionally engaged in excessive drug use to reduce painful, vulnerable feelings. And they also had this really kind of fabulous attention seeker mode, right, which is very flamboyant exterior to deal with this deep loneliness, but also kind of kept others at bay, so they never really kind of knew the real Alex. And then there was the avoidant protector that kind of just shuts people off and expects rejection, so is not likely to kind of create friendships. And in imagery scripting we did, we used little a because it was the same letter as their dead name, and we're comfortable with saying little a, without kind of going into a lot of details. So does that feel, asked what feels right for you? How do you want to imagine yourself as as a kid? And she said, I want to imagine myself as a unicorn, and we did this float back. This is one of the earlier ones. In the multicolored universe with their closest friends that they that they have today, people that they trust. They're now children or animals. Floating in this incredible technicolored universe, really looking at the wonderful clothes that they were wearing, the multicolored hair or mane for the unicorn, and just looking fabulous. And we just sort of reveling in how fabulous she was looking and how comfortable she was feeling in her body, feeling completely free and fluid and at ease, and seeing the acceptance in their friends' eyes and how they feel connected and that they're the same, and that there's no difference between them, and then looking out into the world and that the world feels safe and playful, and so kind of making, I think spontaneity and play and kind of engaging a happy child is sometimes we don't always kind of get there with with imagery scripting, and it's such such an important part to this work with this population.
Yeah, and I think there'll be a lot of people listening and thinking, wow, you can go that far with imagery scripting. It doesn't just have to be little you in your house when you're small, or whatever the trauma is. It's it's really about, and I think imagery is such an amazing tool, but it always has to be carefully considered because of its power as to how we're going to use it. And I understand that when we begin in our training, we get given this script for how it's done, but I really encourage everyone listening to take note of this example, because even for myself, and as I work with more body-based type therapies, they use a lot of healing and positive imagery to evoke strengths and resources, which we don't tend to do that much of in schema therapy. But I think there's something in that, imagery doesn't have to just be about trauma. It can be just used so creatively. So thank you for sharing that example.
Yeah. And I think as long as it's, as being very surgical and targeted around meeting core emotional needs, right? It also always comes from a place of understanding what schemas there are, what were unmet needs, and then just kind of creating a world which meet that need. And that's right. The thing is, it's actually not that outrageous, because in a lot of queer spaces, no one's turning into a unicorn, but it is often very playful and there's a lot of celebration. And I want to get this point across that, the opposite of discrimination isn't tolerance, it's celebration, right? And I think, instead of just, and I think that messaging is important because it's like, for our clients, even though they want to be accepted, and sometimes, depending on where they are, they want to be accepted, but they can aim higher, right? And I think that's what we want to hold as the adult therapist.
So good. Yeah,
right? We want to hold something bigger and better, and we want to bring that into the work.
Yeah, because I kind of see tolerance as actually being probably part of discrimination. It said, we'll just tolerate you, but we don't actually think you're okay. And then you've got acceptance, and then you've got celebration. And because I just watched the City Point drama thing that was on ABC with the school. It was about a trans child wanting to wear a dress to the ball, and then they created a contract basically for enrollment saying that you couldn't be openly trans. It was really quite distressing, the whole story. And it just came to my attention because the child in question was a psychologist's child, and so she was promoting it in one of the groups. But that was the school stance, is that they were tolerant. And if that's what tolerance is, it's actually discrimination. So
and so if you see the opposite of that, right, like if you actually see the child is celebrated, right, if they were, and you see stories of this as well in the news where suddenly they are dean, prom king, prom queen, prom they, whatever term they want to be called. How wonderful. And then it opens up for the whole school to be more of themselves, that they each each individual person is also celebrated. So So
if anyone's interested, that's an ABC story that just aired this week. But I think in the end, it created a celebration of that young person. There was a lot of support, and a lot of former students who were gay and lesbian came back and talked about what it was like for them to be tolerated within that system, and the cost that it had to them. So it's just, I think that's so important, this idea that tolerance is not enough. And if you're a therapist and you're thinking you're tolerant, like that's not okay. We've got to aim higher than that.
And actually one of the first, so we did a presentation, my colleague Ben Caligari, who's in Melbourne, and we did a presentation on this topic, schema therapy for trans and non-binary, so gender diverse folks, in the recent ISSC conference in Copenhagen, and we'll be doing this
in Melbourne.
In Melbourne for the plug for the summer school. And one of the questions we ask our audience is, if you haven't done this work already, we want you to just for a moment ask yourself, how do you know what gender you are if it's not informed by the body that you have? Right. And just there's no right or wrong, just kind of start that process of exploration, and in doing so it creates a sense of connection and empathy. That's really important.
Absolutely. So I'm just thinking, are there any parts of the schema therapy model that you find a little bit problematic and might need to be adjusted for working with gender diverse clients?
I think no. I had a bit of a joke answer, like it's not the model, it's the person. No, I think the complex, I'm really bringing complex trauma work is important. One thing I will say is less a criticism about schema therapy model, but more kind of traditional therapeutic models. It kind of comes from a more kind of Freudian history of understanding or seeing experiences of complex trauma seeing gender diversity as a consequence of poor parenting, attachment disruptions, it's kind of all things like that.
I think one of the things I've come across, which is that people, and this is not my language, right? This is what I've seen written, become lesbian because they've been sexually abused.
Absolutely.
Those are some of the thinking that is still out there. Absolutely. For a reason. And that fits with that model of, well, if you're not, you know, in the mainstream, then you're disordered. So there has to be a trauma that's caused this.
Yes, and that disorder, and this pathologized abnormality is based on a trauma that you've experienced, and it's so problematic. And it's it's synonymous with this idea, this old idea, like, if you're gay, you must have a problem with your mother. Like, it's like such an old belief that it's laughable now, but it wasn't that long ago when this was a belief that a lot of therapists held. And so, and the thing is, like, you do see very high prevalence of complex trauma and PD in population of gender diverse folks. And whilst the relationship is not well understood, but we can see that from our discussion that experiences of ACEs are so much higher in the with gender diverse folks, because that mirroring of the gender identity formation is not there from an early age, right? And then from that comes rejection and discrimination, and and like legislative discrimination as well. And then, as you referred to earlier, like having these discussions in the public domain, that's so harmful to a person. You can see why it can lead to experiences of mental health issues, not the other way around.
Yes, and I think there's also many people, I think the rates of sexual abuse are actually really high in the community as well, and they lead to all sorts of outcomes, and it's kind of just really harmful if we suggest that creates a sexuality. Like, it's probably that the sexuality was always there, and then these abuses have happened on top of that, would be my
and there needs to be much
thinking.
And there needs to be much better research in the connections, but very harmful when the therapist makes those assumptions.
So I think if you're wanting to do this as a schema therapist, there's lots that the model has to offer, and what you have to really do is examine, do you have a pathology bias? Because you can do that with the schema therapy model, right? I do find some people, I love the labels, and then there's this mode, and you've got that mode, but it's not done in a way to be adaptive and helpful and freeing for the client. It's like the kind of what's wrong with you version of schema therapy. So we've got to be very careful not to use it in that way. And I would say, especially with this population, being very careful about how you titrate it, and not just doing cookie cutter versions of schema therapy for them. It's got to really be about them, because we are celebrating them, and in celebration, everybody's got a unique history, and we need to shape the therapy to that, which I don't know what you think about that. Would you say that's
I think, I feel like in a way, schema therapy is a fantastic and perfect model for this. And in an ideal world, this shouldn't, like, it's not rocket science, like, it's not that hard. It's like, schema therapy is all about attuning to a person's internal reality. So I think, it's not the model. The work is not that hard. Like, we can, we're very adept at, reading about whatever that we need to learn. If we're interested in something, we will learn. But it's about this, and there's actually a great thing that Alok Weidman said on ABC News. The issue isn't understanding. There's so much information out there, and people, if they want to know something, they will go and read up about it. The issue is empathy, right? Even if you don't understand someone, if you can empathize with their experience, that's a great place to start. But if you feel like you can't empathize with it because you don't have enough information, then probably the issue is the empathy.
Yes, and see, most therapists would assume that they're empathic, but I think empathy is really about connecting with your client's experiences, and it's not just saying, oh yes, I get what your feelings are in this.
And because gender is so innate, right? It's such it's something that we all experience, but we all experience so differently. And this is an area where we really want therapists to think about their own assumptions prior to just launching into the work.
Yeah, that's right. It's been really, really lovely to have you here today. And I think there's just a lot that people can take from this. And what I'll do is a bit later today, I'll create some dot points above the video so people can see what they're going to learn about. But I just wondered if there's anything that you'd just like to close off with that you haven't covered that you think would be great. I mean, obviously people can find you at the Enlight conference in Melbourne. But just also if there's anything just about working with gender diversity that you'd like to share before we
we're slowly developing this mini workshop with my colleague Ben Caligari. We're hoping to get some more resources out there so that it's easy to disseminate for people who can't make it to the conference, but because we both got a lot of different hats on, so it's a bit tricky. But I will send through some resources of things that people can read as well. And if people need supervision, hit me up for that.
And how do they find you to do that?
Through my website, which is just lifetherapy.org, all one word.
Okay, and you can get your contact details there. So once again, thank you for joining us in Schema Therapy Made Simple today. And I've personally really enjoyed the conversation, and I hope that people take something out of this in terms of expanding their own therapeutic lens and perhaps examining how am I thinking about gender. If I'm staying away from this group of clients, why am I doing that? Is this just something that I could tweak there? Or is it because I'm afraid of this vulnerable child mode and the potential for discordance there? So I think, what we've been talking about today is that basically everything is normal, and it's the social and cultural lens that gets placed on top of that creates this sense that some things are abnormal or disordered. But I think that sort of teaching that you've provided with us today, and also this idea of delighting in people's comfort and celebration of the person, is something that we could just bring into all of our work and enhance our work as therapists. So thank you so much for sharing those ideas.
And thank you, Nadine, for creating this space. I love what you're doing here, and it's so wonderful to have these conversations. So thank you.
Thank you so much. So we'll just say goodbye to the group now, and I'll just have a quick chat with you afterwards. And bye, everyone. Thanks for being with us. Bye.